I have worked and lived in the theater my adult life, and I know that once you engage an audience and tell them a story, they sit forward and they begin seeing themselves. I thought, why not create a theatrical situation where clinicians see themselves?
We got to watch a role play of a physician and a patient that had a serious illness, and we were asked to look for what things went well and what things we might have done differently in that conversation.
Good afternoon, Mr. Fisher. My name is Dr. Horgan.
Okay.
When did you start feeling unwell?
It actually felt pretty real. The physician didn't look at the patient, talked in medical jargon, didn't make any empathetic statements.
Primarily, it was, for me, a lack of connection the doctor was making in the beginning. There was no physical contact, very little eye contact.
Another medication on top of all the stuff I
Log into my chart. It will explain everything.
We were then asked at the table to talk about what went well, talk about what didn't go so well, and what we might have done differently. Dr. Capo, who facilitated that discussion, pulled out from each of the tables some of the things that the actors might be able to do differently.
Why don't you tell me what's been going on?
Well, I'm having a hard time breathing.
Breathing?
Doctor spoke more directly to the patient, not looking at her computer monitor. She was also physically engaged with the patient, touching the patient. Her tone was different. She had really softened her approach.
It's a virus that actually is more common than you can possibly imagine. I know that probably doesn't make you feel great right now.
People were able to hear in practice what palliative care can provide. It really just sort of cut to the underlying ideals that we have as palliative care providers.
We have to teach some of the palliative care skills to all clinicians, and this program provided that opportunity to do just that.
What the foundation is committed to doing now is to engage the community to understand what palliative care is, and for the medical community to understand that they can do their own primary palliative medicine themselves. It's just a question of being able to see a transaction that goes on, make an evaluation and say, now how can I change the way I respond to a patient?